All right, it is time for Morning Rounds. Dr. Alex Harrison is joining us, and we are talking more about heart health this morning.
That's right.
The differences between, this is interesting because you were saying you had learned this recently.
Yeah.
I've always known, just kidding.
I just assumed cardiac arrest was the exact same thing as a heart attack, but that is not the case.
Yeah, no, last time I was here we were talking about Coach Hartman and his heart attack that he suffered a few weeks ago. And we talked about how he also was very, very lucky because he sought immediate medical attention and made it to the hospital and was actually in the emergency room when he suffered a cardiac arrest. And many people don't realize that there's a distinct difference between the two. A heart attack is a lack of blood flow to the heart muscle due to a clogged artery, generally caused by a clot. A cardiac arrest is an electrical short circuitry of the electrical system of the heart. And they can go together, but definitely not always. The vast majority of people who do have a heart attack don't have a cardiac arrest. And you can have a cardiac arrest without suffering a heart attack.
And how do they feel? Do they feel the same?
The symptoms, are they similar symptoms between the two?
Well, a heart attack, you feel chest pain, shortness of breath. I mean, it's variable. Some people manifest symptoms differently. A cardiac arrest, as you can see here in this graphic, is you go from a normal electrical activity to basically a flatline, or what's called ventricular fibrillation, and that's where the ventricles fibrillate, the heart doesn't pump blood, and you pass out and die. And without prompt CPR and defibrillation from an automatic external defibrillator that we're trying to get more and more into the communities, you can ultimately die from a sudden cardiac arrest.
And here with this graphic, you're showing the blockage?
And here's what a heart attack is, and this is kind of what I demonstrated last time I was on, is that you have a coronary artery full of atherosclerosis that ruptures and a clot forms and completely blocks the blood flow downstream to that vessel, depriving the heart muscle of oxygen. And if it's not opened up promptly, that heart muscle will die and you will suffer a heart attack.
So it's pretty obvious. I'm sorry, Patty.
No, I was going to say, this heart attack being the more common thing that people end up in the hospital for versus cardiac arrest?
Correct.
Okay.
Well, I mean, the scary thing is cardiac arrest has a very, very low survival rate, just because if you die, if you're not promptly resuscitated, you're not going to survive.
So if you're in proximity to a defibrillator, which I believe we have installed in the hallway here.
Right.
Yeah, I saw one on my way in this morning.
Yeah, then it could be just a pure situation of chance then, where you are when it happens.
It truly is. And the survival rate of what's called out-of-hospital cardiac arrest is pretty dismal. Anywhere from 5 to 7% of people who have an out-of-hospital cardiac arrest ultimately make it to survive on to live a normal life. And so here's what shows the magnitude of sudden cardiac arrest in the United States. It's the #1 killer of a specific disease in the United States, more than stroke, more than lung cancer, more than breast cancer, more than AIDS, almost combined. And it equates to 900 deaths per day, about 1 every 2 to 3 minutes.
From cardiac arrest.
From cardiac arrest. And so what you see here is you have to have prompt recognition of the problem, call 911 promptly, start CPR, and get early defibrillation and get yourself to advanced care. And that's what's called the sudden cardiac arrest chain of survival. And, you know, it's really a nationalized issue. And there was a New England Journal article last week where Japan made this a big public health issue. And in 2005, they started distributing automatic external defibrillators in the community. And before 2005, there was less than 1 AED, as they're called, per popularized square kilometer. And they increased that to greater than 4 per square kilometer. And they showed that the incidence of people who suffered a cardiac arrest due to ventricular fibrillation, the likelihood of them getting a shock and being resuscitated was greater than 6-fold increase. And the survival rate went from like 10% up to 35%.
All right, we have to cut you off right there, but we'll be back in just 1 second.